So in this video now we are going to see the anti-cancer drugs. Along with anti-cancer we also have immunostimulants, immunomodulators, immunosuppressants. So let's start with this. Which of the following neoplastic diseases is almost curable by chemotherapy? Almost curable by chemotherapy, the disease is choriocarcinoma. Anti-cancer drugs weaken the host defense by damaging respiratory and gut epithelia, inducing granulocytopenia, altering resident microbial flora. So this they basically induce lymphocytopenia, that is there. They also damage the epithelium, and that is how they cause the toxicities. Practically all anti-neoplastic drugs can produce following toxic effects except. So here they are asking except. They depress the leukocyte count, yes. They cause mucositis, yes. They cause cardiomyopathy, no, not very commonly. They cause oligozoospermia, yes. So here the correct answer is this. Alkylating agents exert cytotoxic action by inducing. So alkylating agents, they basically break the DNA strand, cross-link the DNA strand, abnormal pairing, all of the above. So here alkylating agents, they usually result in either there is cross-linking or abnormal base pairing or scission of the DNA strands or cross-linking of nucleic acids. So all of the above is the right answer. A 50-year-old construction worker came to the medicine OPD with complaints of difficulty in breathing. He was diagnosed with malignant mesothelioma. Which of the following drugs can be used for chemotherapy? So here methotrexate, pemetrexate, cisplatin and vincristine. The correct answer here is pemetrexate. It basically inhibits the dihydrofolate reductase enzyme. It is almost of the class of methotrexate and blocks the conversion of dihydrofolic acid to tetrahydrofolic acid. Right? So it inhibits, in addition, it also inhibits thymidylate synthase so that DNA synthesis is affected completely. A 50-year-old male was diagnosed with testicular tumor and was started on chemotherapy with cisplatin, but it was found that the tumor cells showed resistance to cisplatin. Which of the following drugs can be used as alternatives? इन cisplatin के जगह हम यहाँ पे थर्ड जनरेशन कंपाउंड है oxaliplatin. This can be used. Now only difference is they are similar to alkylating agent, but they are similar. They use platinum instead of alkyl groups to form dimers, and effective against cells which are also showing resistance to cisplatin or carboplatin. The only dose limiting toxicity is it causes neurotoxicity, that is peripheral neuropathy. So this has to be taken care of. The most important target of action of chlorambucil is lymphoid tissue. It acts especially active on lymphoid tissue. What is true for docetaxel? Docetaxel is used as a reserve drug for refractory breast and ovarian cancer. L-asparaginase is used for treatment of which type of leukemia? It is used L-asparaginase. This enzyme L-asparaginase, it degrades L-asparagine to L-aspartic acid. So this deprives the leukemic cells of an essential metabolite and causes cell death, and it is used in acute lymphocytic leukemia. A 65-year-old male came to the clinic with fatigue, night sweats and unintentional weight loss. A complete blood count reveals leukocytosis with WBC count of 1,50,000 and immature granulocytes. Peripheral blood smear shows increase in myeloid cells. Bone marrow biopsy confirms hypercellularity with myeloid predominance. On bone marrow biopsy, a genetic abnormality of BCR-ABL fusion is found. The patient is resistant to imatinib. So what is the most appropriate alternative? Now here the patient is basically suffering from this diagnosis that is made here is CML, chronic myeloid leukemia. The drug of choice for chronic myeloid leukemia is imatinib. Alternative to imatinib, we have busulfan here. So busulfan is the correct answer. Which of the following chemotherapy agents cause flagellate hyperpigmentation? This is caused by bleomycin in around 20% patients between the period of 1 to 9 weeks, and it is associated with pruritus. A 65-year-old man with metastatic testicular carcinoma is undergoing chemotherapy with cisplatin. which is not a common side effect, not a side effect seen with cisplatin. Cisplatin does not cause pulmonary fibrosis. It causes ototoxicity, nephrotoxicity, myelosuppression, peripheral neuropathy, neurotoxicity, but not pulmonary fibrosis. What is the mechanism of action of cyclophosphamide? Now, cyclophosphamide is an alkyl group की वो है chemotherapy agent. It basically alkylates N7 of guanine on DNA base. The mechanism of action, it alkylates the nucleophilic groups on the DNA bases. And N7 guanine is the most susceptible, so causing cross-linking and abnormal base pairing. Cross-linking and abnormal base pairing. So like this, we have around 306 questions in this particular PDF. You can go through all the questions, and they are related to the anti-cancer agents and also some immunosuppressants and modulators.